Yeah, well, the federal government held an economic reform roundtable in Canberra earlier this month. I mean, what are the policy changes you might want to see to really help the healthcare sector in Australia?
Well, I actually participated in the health forum a couple of weeks ago, and really there was a lot of conversation about the health transition, the need to move care safely from the hospital setting to the community setting, the need to digitise and invest in technology to support patient and clinician experiences, the need to go upstream, invest in prevention to help improve health today and avoid costs tomorrow. So I think there's lots of reform ideas on the table, and I think the conversation needs to continue. And look, I think what's also very clear is that whilst in other sectors productivity is a numbers game, in health it's about health outcomes. I believe a productive country is a healthy one, and so we need to continue to invest, is what we're doing at Medibank, in prevention and in the health of our members, and that's the secret to long-term productivity as a country.
Private hospitals have been lobbying to get insurers to contribute more funds to the health system. I mean, how much of your private hospital costs been going up over the past 12 months, and what's the outlook like for FY26 when it comes to private hospital costs?
Well, private hospital costs are about 48% of our claims costs. And yes, we have been paying more to hospitals as their costs increase. But equally, there are other deflationary areas of our claims line that means our overall claims experience has been quite benign. We are seeing potentially some slight increases in the claims expectations for next year. But I think when we invest in prevention, when we're investing in personalised care models and our partnership agreements with hospitals we're investing double what we did last year than the year prior, all of this will help us maintain affordability and maintain claims at a level that enables us to keep premiums as low as they can be, so we can have as many people in private health as we can to take pressure off the public system.
We've also had 3 interest rate cuts this year from the Reserve Bank. I mean, how would you rate the strength of Australia's economy right now?
Well, the economic conditions are, in the world stage, doing pretty well, but there's certainly some things we need to work on as a country. I mean, I think the households are still under pressure, and we need to think about the settings for today that are going to help us set up for tomorrow. I think there's active conversations going on, but I think we come from a position of relative strength. But we know changes are needed to sustain both our wealth and our health. We're very focused, as I said before, on investing in things like prevention, on health outcomes. What needs to be funded is quality health, and unfortunately today that is not what is funded. And so everything we need to be doing and investing in is all about maintaining outcomes so we're a productive country, so we can sustain our lifestyle for future generations.
David Koczkar, Chief Executive Medibank, great to have you on the show.
Thanks for having me.